Good afternoon, everyone, and welcome to today's Facebook Live series. This is a series that's hosted in collaboration with East Tennessee Children's Hospital, Tenova Healthcare, Covenant Health, and obviously UT Medical Center. Our Facebook Live series will started yesterday and will extend through Thursday of this week, and will involve our chief medical officers from each of the participating systems being with you live to talk directly about our community COVID pandemic and also to answer questions. Those sessions will occur at 2 p.m. each day. My name is Keith Gray, and I am the Chief Medical Officer at the University of Tennessee Medical Center. I want to pause here to let you know that we're coming live from our media center at the University of Tennessee Medical Center, and I'm going to remove my mask just to facilitate our dialogue this afternoon and let you know that I'm appropriately social distance from other members in our media center. I want to begin today on a more positive note. I've actually been able to give you updates from the Knox County Health Department on a monthly basis, and I learned this from my colleagues at the Knox County Health Department. They start each session with a moment of gratitude, and I want to do the same today. You know, during this time, really over the last 8 months, we've heard a preponderance of bad news, and it's had a negative impact on everyone in our community. I want to start today by talking about some of the victories, some of the advancements we've made, and some of the ways in which we've been able to prepare for the situation at hand. The first is we had the opportunity to watch other parts of the country experienced the COVID pandemic early on in March and early April, specifically New York and Washington. And while our sympathies and prayers continue to be with those places, we learned a lot. As you recall, we were under a stay-at-home order. We had stopped non-essential procedures on the hospital side. We had limited supplies of PPE, limited COVID capacity, and testing capabilities. But we did not see a significant surge of COVID during that time. But we were able to prepare, we were able to obtain those adequate supplies of PPE, expand our COVID testing capabilities and capacities, and learn a lot about the virus before we experienced the situation that we are currently in. Also, what we were able to do is prepare a platform for our children to continue to be educated. And this is not an argument about whether live learning is better than distance learning. The acknowledgement is that our kids are able to learn in this current COVID environment because we were able to set up platforms to allow distance learning in our community that previously did not exist. We also, from a healthcare standpoint, we were able to establish telehealth platforms that were rudimentary at best prior to the COVID pandemic. We learned just this morning that at UT Medical Center, we performed just as many telehealth visits this month as we did in the month of March. And so again, we were able to set up those platforms before we got into the second wave of the COVID pandemic. And lastly, but certainly not least, we've continued to build on the communication and collaboration that already existed between our 4 major health systems in the area and also with the Knox County Health Department. Not only has that been very impactful and very significant during this time of pandemic, but it will pay significant dividends regardless of what we face in our community going forward. So having acknowledged the gains that we've made, we are in a current crisis. I think the time that we're in right now is what we anticipated back in March and April when there was a big unknown. We've experienced a wave of increase in new cases really over the last 6 weeks or since the beginning of October. We've seen a significant and precipitous increase in the number of new cases in our community. Just in the last 3 days, we've had over 1,000 new cases in Knox County alone. What that means is that when we experience new cases, while many people are asymptomatic, while many people experience very minor symptoms, we know that approximately 4% of new cases diagnosed will be hospitalized. So what does that mean? For every 1,000 cases, there will be 37 to 40 new hospitalizations in our region. And while that number seems very small, and 2 months ago, it took us several days to have 1,000 new cases in our community. As I mentioned before, we've had 1,000 new cases in Knox County just over the last 3 days. So again, that equates into nearly 40 hospitalizations, again, in just over the last 3 days. Coupled with that, we are in a season of significant challenges that could pose the risk of exacerbating the spread of disease in our community. We have fewer hours of daylight, so people are spending a lot more time inside, closer quarters. We have colder weather, and so again, people are not choosing to exercise outside. They're not able to gather outside. While we've had unseasonably warm weather, that will likely end here in the near future. And again, we will be forced to spend more time in close proximity to each other, which has the potential to exacerbate the spread of disease in our community. We have an impending flu season. And again, I wanted to acknowledge really nationwide the job that we've done in getting our community vaccinated with flu vaccines this year. We've had a record year in flu vaccinations. However, the flu vaccination does not prevent everyone in our community from contracting the virus. And so while we advocate that you do get your flu vaccine, for those that don't, or for those that still get the flu despite a vaccine, that has the ability to, again, continue to negatively impact our healthcare systems and our ability to care for all patients in our community, those with COVID and those without COVID. We have college students returning home from most parts of the country after spring break. Again, they're coming from all parts of the country back to their home in Knoxville. This has the potential to bring potentially an asymptomatic virus back to our community and adversely impact people in their home and also people in their community. So you may want to really familiarize yourself with the policies of your respective kids' universities and colleges. Will they be tested before they return home? And if not, we need to really emphasize the 5 core measures when they return home for them and for all of your family. And obviously, we have a holiday season quickly approaching. Thanksgiving is next week, and then the Christmas season or the holiday season extends through early January. There's people in our community, they're going to be clustering for shopping. Although Black Friday has been canceled as we know it, there's still increased interaction with each other through the holiday season, whether it be for meals or for shopping or for celebration for the holidays. We ask that you, again, familiarize yourself with the 5 core measures and really abstain from gathering in large crowds. When you do, adhere to strict hand washing, cleaning high-touch surfaces, and wearing a mask when at all possible. We've got some promising news on the horizon. Everyone on this call has heard over the last 2 weeks, we've had some really good news from Pfizer and even better preliminary news from Moderna. We have hope that the early distribution of the vaccines will be available as early as December. That remains to be seen, and obviously we're not making any promises, but we remain hopeful for that the first round of eligible people will be able to be vaccinated in early December. COVID-19 has impacted everyone in our community. Everyone is first of all, has been impacted either directly or indirectly. Everyone is experiencing fatigue. And so the question is, how do you maintain your resolve? How do you maintain your commitment to keeping our community safe when it seems like our fight against this pandemic has lasted a significantly extended period of time? I would ask you to take on the sentiment of a Good Samaritan in our community. As you recall, in that story, the Good Samaritan thought more about what would happen to the person that had been left on the side of the road than they thought about what would happen to them as an individual. And so that Good Samaritan chose to put themselves potentially at risk by helping this person. But again, he had the other person's interest in mind when he did that. And so I ask you today to reach down and, if you will, gain a second wind. And if you're having a hard time doing that, ask yourself, not why you are doing it for yourself, but who can I dedicate my efforts to? Who can I dedicate my adherence and compliance to the 5 core measures to to help keep our community safe. Maybe it's a teacher, and by wearing a mask or by appropriately social distancing or by being responsible for appropriate hand hygiene, you may allow a teacher to continue to offer live classes to the children that choose to go to school for continued learning. You may keep a frontline worker safe so that they can continue to work in our ICUs or work in our emergency departments and care for patients with and without COVID, and keep our hospital systems open for all members of our community, no matter what their illness is. It may be an elderly person who may or may not have comorbidities that put them at even greater risk. By adhering to the 5 core measures, you help to keep them safe. And lastly, it may be an essential business worker. It may be your essential business worker that helps keep our community open and thriving even during the peaks of our pandemic. Another thing that I would ask you to do, that you can do in a responsible fashion, is check on people in our community, especially our elderly, who may be vulnerable to social isolation as we navigate this pandemic. Phone calls, even though they can't always see your face, phone calls are helpful. Text messages are helpful. FaceTime is helpful to help mitigate some of that social isolation that everyone in our community, elderly or otherwise, is experiencing some level of at this time. Again, as I mentioned before, we've had unseasonably warm weather, and I ask you to take advantage of that time, get outside, exercise. That not only will help with our physical health, it will help with our mental health. And again, it's an opportunity for you to, if you're appropriately social distanced, to take your mask off and just enjoy and inhale some of the beautiful weather that we're having in our community. We again ask you to limit social gatherings as we approach our holiday season. Think of novel ways to celebrate Thanksgiving with your families. I know that I have a family of 7, my wife and I, and 5 children. You know, just looking at the forecast, there's a possibility that we will be able to celebrate Thanksgiving outside around a campfire in our backyard. We're just looking for novel ways to be safe, maybe have a few friends over, but to be safe and still enjoy the company of each other during the Thanksgiving holidays. We're going to avoid travel, and we're going to avoid gathering in large groups with the remainder of our family for the Thanksgiving and also for the Christmas holidays for us. Again, we can do this. If we partner together, we can continue to navigate this for the foreseeable future if it keeps our community safe, allows us to stay open, allows us to care for patients in our community with all types of illnesses if we commit to the 5 core actions. And as a reminder, those 5 core actions are wearing a mask, socially and physically distancing from each other at least 6 feet, frequent hand hygiene, disinfecting high-touch surfaces, and staying at home when you don't feel well. And I can't advocate those 5 core measures enough. And we've seen them so many times, we start to take them for granted, but they're still the most important thing that we can do. And if you are sick otherwise, or if you have preventative screenings or maintenance health that you are scheduled to have, we encourage you to continue to do that. There, again, as I mentioned before, there's an option to do that by telehealth, but I do want to let you know that it is safe to return or to continue to come to our hospitals. We are continuing to limit visitation to 1 member accompanying patients that have appointments or on our campus or who are inpatients. All of our team members are wearing masks. All of our team members are adhering to the 5 core measures to not only keep them safe so that we can continue to take care of you, but to keep them working so that we have the capacity to meet all of the needs of our community. And so with that, I think that those are all the prepared comments that I have, and I think we're going to open it up at this time for questions. I've got members here in the studio that are going to read those questions as they appear in the chat room.
Dr. Gray, we got a question earlier this morning. Any local data yet on survival rates of patients with COVID-19 and autoimmune disorders? And also any information about lymphedema patients, how they may be affected beyond the norm?
So I think everyone was able to hear the questions. That is a question about the impact of COVID-19 on patients with autoimmune disorders and also patients specifically with lymphedema. As you realize, these are small subcategories of patients that have been potentially impacted by COVID-19. And while we don't have that data specifically, I will roll autoimmune disorders and also patients with lymphedema potentially in the category of patients that may be immunocompromised. We know that patients that are immunocompromised, just like patients with other extended comorbidities, i.e. COPD, diabetes, morbid obesity, are all at increased risk of having an adverse outcome if they contract the virus. And so again, we go back to the core measures. If you are in that population of patients, if you're either elderly, have significant comorbidities, especially if you're immunocompromised, like the question that was asked, I recommend that you take all the necessary precautions, even extra precautions, to adhere to the 5 core measures. My parents are in North Carolina. I haven't been able to see my parents this year, is because they do have comorbidities. They do fit the criteria of an at-risk population based on their age, and they've chosen to really go above and beyond to keep themselves safe, and so far they've been able to do that.
We also had a separate message that said, do you think wearing a mask makes a difference, and why?
So the question is, does mask wearing make a difference? And so there's a study that has just been released from Vanderbilt School of Medicine from their Division of Health Policy. I think the date was November the 11th, and they talked about specifically the data that they have from the state of Tennessee. They looked at early adopters and even late adopters of the mask ordinances in the state, and they looked at counties whose residents didn't have a mask ordinance, and they presumed from that who didn't wear mask consistently. And they looked at the death rate, and there was a significant difference in the counties that had a mask ordinance, whether it was an early ordinance or a late ordinance, versus those counties that didn't, in the death rate in those counties. There was a precipitous decline in the death rate at the time of the mask ordinance, and there was a continued increase in the death rate in those counties that did not have a mask ordinance. And so based on that data, and based on the fact that COVID-19 is spread through aerosol and droplets, we have to presume that mask wearing makes a significant difference in the decrease in COVID-19 spread and flatten the curve. And one last thing I will say related to that question, they said that people that comply with mask wearing, it could be a surrogate to say that they are also more compliant with the other 4 core measures. And so it's not mask wearing alone, it's mask wearing plus the other 4 core measures that likely make a difference in flattening the curve in our community.
This is a question from Austin Martin from WATE. It's a 2-part question. What is your advice to those who think they have been exposed to the virus, and the timeline to get tested if you do believe you have been exposed?
For those who believe that they have been exposed to the virus, the first thing to do is to quarantine. I also think it's important that that person be tested, not because it's going to change your likelihood of quarantining, but if you know, then the contact tracing, if you are infected with COVID-19, then contact tracing needs to be done to appropriately protect and quarantine other members in our community that may have been exposed to your exposure or who may have been exposed to you. The ideal time to be tested after the known exposure is 5 to 7 days. So said in another way, an early negative test may not be a true negative test. There may not be enough of a viral load to create a positive PCR or a positive antigen test. And so if that first test is negative, then and you know exactly when your exposure was, I would encourage an additional test or quarantining until you're 5 to 7 days out, and then obtaining a test that is more likely to be a true indication of your disease status.
Grace King asks a 2-part question. What is it like treating COVID-19 patients, and what's the average length of stay?
That's a great question. So the question was, what is it like on the front lines treating COVID-19 patients, and what is the average length of stay? And both of those I will answer based on my experience here at UT Medical Center, but in collaboration with the other health systems, I think their experiences are the same. And so I am a cancer surgeon by training, and also, as we mentioned before, the chief medical officer. So in my new role, I'm not on the front lines, but I have had the opportunity to go and visit many patients in our hospital that have been impacted and infected with COVID-19, both in our acute care facility or acute care beds and also in our ICU. And the first word I would use that is very variable. Most patients present in respiratory distress. Most patients that are in the hospital require oxygen, and when they no longer require oxygen, we try to get them home after they've been treated appropriately. But the disease spectrum is very variable to the point that they require significant oxygenation. Others require prolonged ventilation. But overall, again, we know that if you're elderly, and those that are elderly and those with significant comorbidities are likely to do worse and have a higher risk of a death related to COVID-19. And to answer your second part of that question about length of stay, our average length of stay currently is in the neighborhood of 7 days for all patients.
There's another question from Grace King. What is your biggest concern with the rising number of COVID-19 hospitalizations right now?
So the question is, what is my biggest concern related to the rising number of COVID hospitalizations right now? So I want to go back a little bit and just give a little bit of history. We know that COVID hospitalizations are preceded by an increased number of COVID positive cases in the community. So the first thing that we can do, again, is increase our adherence to the 5 core measures. If we can start to see a turn in the number of new cases, then we know that in 10 days to 2 weeks, we will see a decrease in the number of new hospitalizations. So we have to start with the root cause. The second thing is, obviously, we want to keep our team members safe. And as the spread of COVID rises in our community, everyone is at risk, even our patients, even our team members who are caring for patients in our community. And lastly, we want to do everything possible to flatten the curve of COVID-19 in our community, because we want to continue to have capacity to care for not only COVID-19 patients, but other patients that have other diseases that existed prior to COVID-19. We wanted to continue to have adequate space and adequate team member capacity to care for those patients and all members of our community.
There's a question from Austin Martin at WATE saying that you touched on the elective procedures pause that the hospitals put in place. Could this happen again in the next few weeks?
So the question is, could elective procedures be halted or diminished over the next few weeks in order to create capacity in our hospitals? And the answer is, we don't know. We're looking at all opportunities to continue to have adequate capacity in our hospitals. I want to contrast the current situation with our last situation. As you recall, we stopped elective procedures all across the country at the request and at the advice of our national leadership, because we had different constraints at that time. We had PPE constraints, we had testing capacity constraints that we had to fortify before we could really open back up for elective procedures. And we did not know the natural history of this disease, and we didn't know if we were going to need capacity and need extra staff that were currently doing elective procedures. So that was our reason in March and April. Now the constraints are different. Again, we have adequate PPE, we have adequate testing capacity, we know more about the natural history of the disease, and we know that we want to keep all of our team members working if at all possible. By delaying elective procedures back in the late spring, we know that, or we feel like there was an exacerbation of disease in our community as patients had their procedures delayed. We want to avoid any delay in care for any member of our community going forward. So while it may be necessary, that is not the first lever that we will pull, and we will do everything possible to continue to work at full capacity through the peak of this pandemic. So I think we're going to close the question and answer session at this time. I want to thank you for tuning in for this second part of our Facebook Live series that, again, will extend through Thursday of this week, and will give you an opportunity to hear from all of the chief medical officers across the health systems related to COVID-19, different aspects of that disease and the pandemic. You had an opportunity to hear from Dr. Joe Childs at East Tennessee Children's Hospital yesterday. Again, I am Keith Gray, Chief Medical Officer at the University of Tennessee Medical Center. And tomorrow you have at 2 p.m., again on Facebook Live, you will have the opportunity to hear from Dr. Frank Berline, who is the Chief Medical Officer for Tennova Healthcare. Specifically, he will be on Turkey Creek Medical Center's Facebook page tomorrow, again, November the 18th at 2 p.m. for a live question and answer session. Again, thank you for your attention. We thank you for your questions, and more importantly, we thank you for your partnership in keeping our community safe.